Steve Jobs credited acid as one of the 2 or 3 most important things he did in his life.
Sure.
What do you think about drugs? Is there a drug called DMT?
Sure.
What is that?
Yeah, DMT is dimethyltryptamine, and it's one of the most potent hallucinogenic substances.
How do you get it?
In the world. It's not legal, so people probably have to go underground to get it.
Is it a pill? Or?
Some people smoke it, and I think that there's a toad.
What does it do for you?
Well, it basically makes you experience a form of psychological death and potentially...
Oh, that'd be happy. Why not? Why would I want to do that?
Well, it's really interesting. So DMT, as well as other classic psychedelics like psilocybin from the magic mushrooms and LSD, are now being used in clinical trials at places like Johns Hopkins University, Imperial College of London, to treat people with treatment-resistant depression and anxiety, including end-of-life anxiety from cancer diagnoses. And it turns out that a single session, of course in a controlled environment with the right guides, of something like magic mushrooms, cures depression in 80% of patients who do it, because the experience is a form of inverse PTSD. So PTSD comes from trauma, but when you have an experience that's so radiant and sublime, seemingly connecting with the cosmos, as people describe when they're tripping on these substances, they come back and they're no longer afraid of death. They're no longer depressed. They're no longer anxious. So it's the results are astounding, and it's for that reason, by the way, that the FDA has recently designated MDMA as a breakthrough therapy for PTSD. MDMA is another one of these classic psychedelics.
So it'll be approved?
I think it's going to be approved in increasingly clinical settings with controlled environments and filtered patients, for sure. And I think it's going to be a telescope for psychiatry.
Watch new episodes of Larry King Now Monday, Wednesday, and Friday on demand on Aura TV and Hulu.